Good afternoon, everyone. My name is Lauren Leviton. I'm a PhD candidate in the Health Sciences Integrated PhD program at Northwestern in the Feinberg School of Medicine in the Healthcare Quality and Patient Safety track. And I'm really excited to be here today to talk with you about my research on enhancing screening and referral for social needs. So I'd like you to think about the last time that you went to the doctor's office. You may have been asked some questions about whether you were experiencing social needs. And what I mean by social needs are whether you were having any difficulties with housing, transportation, or food. And prior to joining the PhD program, I worked as a social worker for many years in healthcare settings and continue to work part-time as a social worker while I'm pursuing my degree. And I have observed the clear relationship between social needs and negative health outcomes. Now, I know that I asked you to think about the doctor's office, but what I'm trying to do is understand screening and referral in the hospital. And there's very limited research about how to do this well in the hospital. And there's current policies that are requiring hospitals to screen and then refer patients to community-based organizations in response to social needs. But so many health systems are doing this differently, and nobody really understands the best approaches to doing so. So for example, when should screening happen? Should this happen when the patient is admitted to the hospital, or on day 2 of the hospitalization, or maybe even just before they're discharged? And what about who should be involved in delivering this intervention? Should it be nurses, or social workers, or community health workers? And what about the screening modality? Should this be a conversation that happens between a staff member and a patient, or should the patient be provided a written screening tool that they can answer in a more private way? And so my research objective includes studying a current process that's used at one hospital system and identifying barriers, or what gets in the way, and facilitators, what helps that process, and then to identify new strategies based on the information that we find to screening and referral in the hospital. And so I thought it might be helpful to go through what the actual process at one system includes. And so this is how it works at Northwestern Medicine. First, the nurse screens the patient when they're admitted to the hospital. And this is a verbal conversation that happens. So let's say the patient reports a need. So after they're asked about whether they're experiencing any needs, patients are also asked about if they're interested in assistance. And if they're interested in assistance, a social worker, ideally, meets with patients and reviews some community-based organizations that may be able to help address their needs. And then the patient receives a list of those resources when they're discharged from the hospital. But is screening right when the patient is admitted to the hospital really the best time? The patient may be experiencing medical needs that may not allow them to participate in a verbal conversation with the nurse. And will the nurse really have the time to do the screening when they're trying to manage their patient's symptoms or are attending to other patients? And so is screening at admission the best time, or maybe the second day after the patient spent some time in the hospital and may be a bit more stabilized? And how do we create an environment or a quick relationship in which someone feels like they can comfortably disclose that they're experiencing social needs? For example, I've been working as a social worker, and it really takes time to develop relationships with people in order to feel like there's a trusting relationship to disclose that they're experiencing housing instability or food insecurity. And I know that the hospital is a quicker time, and that there could be strategies that could allow for developing and establishing more safety for someone to feel like they can share what's coming up for them. And just because a patient is experiencing a social need doesn't necessarily mean that they're interested in assistance. So perhaps they've tried seeking out assistance in the past from a community-based organization, and it didn't work out for whatever reason. And like social workers, or like nurses, social workers are also very busy in the hospital setting, trying to set up equipment for patients or working on a transfer to a skilled nursing facility when the patient's being discharged. And so will they really have the time to be able to sit with someone and review resources that may be available to them? And while it's fabulous that patients get a list of resources that may be able to help them in the community, some patients might need a better approach. For example, I sit with many of my patients and help them make phone calls to community-based organizations and follow up to check in, hey, did that work out? What got in the way? How can we be supportive? And so, again, just to recap, my research is hoping to contribute and understand best practices for screening and referral for hospitalized patients. And ultimately, we're hoping that this improves the quality of care that patients receive and improves safety outcomes as well. Thank you.